This is Chapter 11, Part 3. We were talking about some of the physiological effects of THC, of the psychoactive ingredient in marijuana. And this next one we have here, the slide here, is shows a graph of ER visits for young people due to some, some bad high, some bad reaction with marijuana. And you can see, we'll get to the PowerPoint highlighted note here in a second that will show that these have been increasing. But of course, I always want to bring in newer data because the textbook's always outdated. And so this was from 2019 to about 2023, so it's a little more recent. You can see that it's 4 different age groups here: little kids 0 to 10, 11 to 14, 15 to 24, and less than 25 years of age. And so this is, and on the y-axis you can see that this is cannabis-involved emergency department visits per 1,000 emergency department visits. So it's a little bit of a problematic statistic. It's talking about what's the share, what's the percentage of ER visits that are kids showing up with a problem with marijuana. And you can see that, this number here for teenagers and young adults, 15 to 24-year-olds, for example, you can see that the blue line is for males, the black line is for females. And there you see for females in 2019, like about roughly 75 out of per 1,000, right? So that would be 7.5% of these kids that are going to the emergency room are going there for marijuana. For guys, it's be more like 15%. And that there's been a tendency, it's not clear always, but what you do see, what is clear is you see kind of a spike with COVID. When COVID hits 2020, you see a jump in all these groups of ER visits. And then you can see that with some age groups, it lasts longer. It kind of bounces, you can see here with the less than 25-year-olds that it gradually drops down through 2023, let's say. And then with 11 to 14-year-olds, you see a little bit of a continued increase into 2022. So it's bounced around a lot. I think the way I would take away this newer data is that COVID seems to have caused an increase. At least the beginning of COVID caused an increase among these kids in this sort of problematic, probably with a lot of time on their hands, not in school. You find a lot of kids when they're unsupervised and with a lot of free time on their hands, you see kind of problematic behavior. It's true if you're studying delinquency or criminal behavior, in this case, underage, this use of marijuana, that you tend to get that with lack of supervision and kids having a lot of time on their hands, that kind of stuff. So that's probably part of the explanation of what's going on with these young people. Some of these are people who be a little bit older, but you see a spike and then a tendency for it to come down, but not. Again, it kind of depends on which group you're talking about. So I think that's the main story here would be that COVID showed a greater problem. If we just go back to the older data and the highlights, you see hospital emergencies related to marijuana on a nationwide basis have doubled from 2006 to 2014. So that's a little bit older data. Our data started with 2019. So it's gone up over the long haul, going back a couple of decades. And we saw that probably COVID had to do with some more recent increases. Historically speaking, of course, we're talking years here, not something brand new. But a consistent finding has been the preponderance of emergency cases associated with the ingestion of marijuana in combination with alcohol or other drugs. So, you're going to have more problematic situations and more ER visits if you're talking about mixing drugs, and again, some drugs that are more problematic than marijuana. And also it's it's possible that the increasing THC concentrations could sometimes result in someone having a bad experience, taking a little too much and it causing a bad experience, and they land in the emergency room. Nonetheless, increased marijuana toxicity is a medical concern. It is likely that the higher THC concentrations in marijuana have contributed to the greater number of emergency department visits, since these increases are greater than the increase in the prevalence rate over these periods of time. So what that last part is, what they're saying there, is that you have seen over time, especially about the last decade, I've got some slides later on, that show an increased use, a higher percentage of kids or adults are using marijuana in, say, the past decade or so. And so they're saying above and beyond the fact that you got more people using, there could be other things that result in more people ending up in the ER, like this increased concentrations of THC, mixed use with other drugs. But so it's, it is a medical concern if the drugs are getting more and more intense and more concentrated, because you do tend to see more complications with these very high levels of drug taking, right? It should be noted that there have been no cases on record of a death due exclusively to the ingestion of marijuana. So we're not talking about overdoses, lethal overdoses. We're not talking about people dying in the ER due to taking marijuana and only marijuana. So that, because again, this is not a drug that has where you have lethal overdoses. It's not. We got to make sure that we keep these different types of drugs separate from each other and the kinds of dangers or risks that are associated with each different type. With marijuana, it is likely that a first-time smoker will feel no discernible effects at all. It takes some practice to be able to inhale deeply and keep the smoke in the lungs long enough for a minimal level of THC, particularly in a low-quality marijuana, to take effect. Okay, so that's a common experience you've heard over the years, is that people who are new to this, who try it out, may not feel anything, and that a lot of it has to do with sort of improper intake. They don't know how to do it, they're not experienced, and so it takes certain experience, skills to be able to be taking this in a way where you get that, or you get a real high or a strong high. Novices or beginners often have to be instructed to focus on some aspect of the intoxicated state to start to feel intoxicated, but the psychological reactions, once they do occur, are fairly predictable. So there is kind of an aspect of learning how the drug is supposed to feel, identifying that. So there's kind of a learning curve there. And usually almost always people are introduced to various types of drugs, and this is true of marijuana, in a social setting. People usually try some drug for the first time in a group, in a group of friends, at a party, some social event. That's where it typically occurs, and that's where you sort of learn from others how it's done and how you're supposed to feel, or the different details of the experience. So that stresses the sort of social element, and here we're bringing in the discipline of sociology, that the social element is very important when you're talking about drugs, because it's usually in a social context and not alone that you're being introduced to these drugs, that you're learning how they're done and how they're done in a way where you get an effective high and all of that. So indeed, the social aspect is very important here. The marijuana high is a feeling of euphoria and well-being. Marijuana smokers typically report an increased awareness of their surroundings, as well as a sharpened sense of sight and sound. So increased awareness, feeling of euphoria or well-being, happiness, up, good, feeling good. Frequently, they feel that everything is suddenly very funny, and even the most innocent comments or events can set off uproarious laughter. So again, that's part of the euphoria, the sense of well-being, that laughter is related to those sorts of feelings. Usually mundane ideas can seem filled with profound implications, and the individual may feel that creativity has been increased. So that's a common understanding or perception of marijuana, is that it can increase creativity, or it can sort of give you insights that you couldn't have sober, all of those sorts of things. As with LSD, which we'll talk about later on, there's not really objective research evidence that creativity is actually enhanced by marijuana. It may be more the perception that comes from the experience, because your awareness, your focus is sort of shifted, your awareness is shifted, and that can give the sensation of sort of this, creative insights, of seeing things differently, of a different perspective. But it could be just kind of a focus shift. Commonly, time seems to pass more slowly while a person is under the influence of marijuana, and events appear to be elongated or lengthened out in duration. Finally, marijuana smokers frequently report that they feel sleepy and sometimes dreamy, or it could be just relaxed. It doesn't have to be that intense as feeling really sleepy. It could just be a relaxed sort of feeling. So those are some of the feelings and perceptions that people report when they're using this drug. Relatively low THC concentrations in a marijuana joint are not sufficient to be particularly sleep-inducing, though stronger cannabis preparations with higher THC can have strong sleep-inducing effects, particularly when they're combined with alcohol. Alcohol, we'll talk about later, is a depressant. It slows down the system. So it has that depressant, can have that relaxing or sleepy kind of effect depending on the person. Of course, we haven't really talked about individual differences a lot, that everybody's wired and put together differently, so people have different experiences because of that. Marijuana produces significant deficits, I should say, in behavior. The major deficit is a decline in the ability to carry out tasks that involve attention and memory. So let's focus on those two, attention and memory. Speech will be increasingly fragmented, broken up, disjointed. Individuals often will forget what they or others have just said. The problem is that marijuana typically causes such a rush of distracting ideas to come to mind that it's difficult to concentrate on new information coming in. So there can be a concentration problem with the flood of distracting ideas and perceptions. Then it can become difficult to concentrate. By virtue of the diminished focus on concentration, the performance of both short-term and long-term memory tasks is impaired with the use of THC. In general, these difficulties grow in magnitude as the levels of THC increase. So we're talking about diminished concentration, but having greater difficulties with both short-term and long-term memory tasks. And here, when we say memory tasks, we're talking about experimental research that's been done on people who take marijuana. What are the effects? How does it affect the memory? Well, it tends to impair short-term and long-term memory in this experimental research. Complex motor tasks, such as driving a car, are also more poorly performed while a person is under the influence of marijuana. So it's not just a lab sort of situation, but when you bring it into real life tasks that have to be done, there can be complex motor tasks, which in driving is a really good example of a complex task where it involves movement and control of the wheel and the pedals and your eyes and everything else. It is not necessarily a matter of reaction time. Studies of marijuana smokers in automobile simulators indicate that they are as quick to respond as control subjects. So it's not really that it's slowing down your reaction. It's not a slowing thing. Instead, the problem arises from a difficulty in attending to peripheral information and making an appropriate response while driving. So we're talking about, where are you placing your attention? Is your attention on the right thing, the relevant thing when you're driving? I mean, if if a car's going to cross your path, of course, that's the thing you need to be focused on, not some pedestrian over on the side of the road who's is irrelevant to where you're driving, right? So the concentration, the focus issue can be an issue, as also when they say making an appropriate judgment or appropriate response, that I think is getting into sort of a judgment area there, right? Being able to see all the relevant factors and making a proper judgment in response to that. Given these observations in the laboratory and also on the road, it should not be surprising that marijuana use would increase the risk of having an automobile accident. So this is of course is an issue, just like driving while under the influence of alcohol. This is another issue, driving under the influence of marijuana as well, especially since use of marijuana has become more common and widespread among people of the old enough to drive. Surveys that have examined accident rates among drivers testing positive for THC in their bloodstreams have shown them to be about 3 to 7 times more likely to be involved in an accident than drivers testing negative for THC or alcohol. So that's a pretty, when you talk about risks that are three times higher, so 7 times higher, that's a big increase in risk. So that's saying that there's a real risk associated with THC use when you are driving an automobile. Let's see. Let me stop there. I think we'll get to some charts here, but let's take a break and we'll continue on in part 4.